We went in for our routine 18-week ultrasound. The ultrasound technician actually left the room and came back in with the doctor. And they then told us that she had a unilateral cleft lip.
About 1 in every 750 infants worldwide are born with cleft lip or cleft palate, or both.
Elizabeth's cleft was diagnosed in utero. That's frequently what happens now. Something happens during the first trimester to prevent these pieces of the face or pieces of the mouth from coming together and fusing completely. And the opening that's left behind is called a cleft. Now, most clefts are probably not genetic. We don't know exactly why it happens. It may be a combination of some environmental factor or some genetic factor.
For us, it was very shocking, and I'd say kind of an unknown panic.
We didn't know the severity of it. We didn't know if the palate was involved. So we had all these unknowns. We were just at that point trying to really focus on trying to provide the best health and to find the best solution we could.
It can be kind of a scary diagnosis. Not many people know what it is. They don't know what is in the future for the child. And if you come in and you see a good cleft team, they can really tell you what it means, how it happened, and what you need to do to repair it.
The team at Johns Hopkins Cleft and Craniofacial Center includes a geneticist, a pediatric ear, nose, and throat specialist, a hearing specialist, an orthodontist, a speech pathologist, a nurse coordinator, a dentist, a feeding specialist, and a plastic surgeon. Each year, the team treats nearly 650 children. The goal at Johns Hopkins is to help each child reach their full potential and to experience their life to the fullest.
We went in and met with Dr. Redett and his team, and I think I remember the first thing he did was say, "Congratulations on your pregnancy," which made us feel normal. It wasn't an issue. The cleft was so secondary.
He put this positive spin on, a negative thing at the time, which kind of transformed the way that we looked at things.
He sat down and pulled out a piece of paper and actually started drawing what was going to happen, what the chances were of what she would have, and it seemed like such a normal thing to happen to a baby.
Dr. Redett stressed that it was a curable problem, it was a fixable problem.
Due to the nature of Elizabeth's condition, she only required one surgery at this time.
When we do cleft lip surgery, the goal is to give that child as normal appearance as possible and to allow them to have as normal dental development as possible. So if you go into surgery with those goals and you do everything you can to achieve those goals, you're going to have a good result.
For families who have a child born with a cleft lip or palate, there's an increased risk of having another child with an oral cleft. That was the case when their third child, Ryder, was born.
We're shocked by the news again because we had gone into this pregnancy thinking there wouldn't be anything.
Most people have a very low risk of having a child with a cleft lip or palate, depending on what your ethnicity is, but your risk of having another is a little higher. It's not much higher, but it's a little higher than the rest of the population.
A consult with Dr. Redett revealed that Ryder would have surgery at 10 months, with similarly positive results.
He's basically a normal baby at this point who will have surgery down the road, but based on our experience with Hopkins, for us, it was a simple decision.
This family really exemplifies what we like to see. They're super positive. You know that those kids are going to do really well as they get older, even with a cleft lip and a cleft palate. I think the family has a lot to do with how well these kids do as they grow up.